I am a part of disaster management relief team of University Medical College Hospital, wherein we provide health services to the older people during emergencies like flood and the earthquakes that are common in that region, especially in the relief camps. I shall be discussing regarding the care of the elderly people with dementia during emergencies like natural disasters. As we all aware that people living with dementia in a community face more difficulties and challenges, especially during natural disasters, because the natural disasters like flood, earthquake, fire or tsunami occur suddenly and without much warning in most of the instances. Of course, now we are having a very good system wherein at least 48 hours prior we are given the information regarding floods. During a natural disasters, the whole building or a community or the village is affected, because of which the older people and different people differently abled are shifted to new premises which they are not familiar with. Now, how the older people differ from those of the adults during such situation when we go and provide the services to them? According to United Nations, they categorized the people who require specific needs are the older people who are living with dementia or multiple comorbidities. A person living with dementia may not understand the emergency situation. He just keeps observing what is happening around him. This leads to a behavioral changes in them too. So the caregiver should ensure that they have a stock of regular medications that are used for dementia, as well as for diabetes, hypertension, ischemic heart disease, stroke, and what all the diseases they are taking regularly. And the aids like spectacles, dentures, walkers and hearing aids should be kept in spare and handy and should be able to carry as and when it is required on a short notice of an emergency. The caregiver should also address the fear and anxiety in the older people with dementia, and most of the times it is known that the caregivers are often unprepared to handle such an unprecedented event that takes place in their home, because they have to take care of the children, they have to take care of themselves, the other materials in the house apart from the older person living with dementia. My discussion has the objectives that what the caregivers should understand that happens in the event of a disaster and how to be prepared for it in a given time, and to make a plan for what to do when a disaster takes place, and to ensure that they tailor the plan to meet the specific needs of a person with dementia. And its most important objective for providing services is to ensure these persons are not missed or lost while providing care. It is the duty of all of us to ensure that person returns home safe once the disaster settles. What are the challenges that we face when we provide services to the older people in emergency situations like floods or earthquake? These people, apart from dementia, they also have vision and hearing impairments. There are certain older people who will be living alone in the home, wherein their children are away from the job and in the midday the disaster may happen. There are older people who are differently abled. They require a lot of support to shift from the bed, and older people who are using aids like walker and wheelchair. These are the challenges for providing services. And those older people who are having multiple comorbidities and require more drugs to control, especially the diabetes and hypertension. So we need to have the concept that we are going to face these challenges and ensure that these challenges are met while we provide the services. How the disaster has an impact on person living with dementia? It is evident that emergencies worsen the symptoms of dementia and adds to new symptoms. That is very important thing one should know. And most of the time for the older person dementia, any disaster can be very scary and confusing. That is one thing we should understand. And they may develop mood and behavior changes, including feeling angry, distressed, agitated, and withdrawn. And already the family caregivers are themselves they are in anxiety, and they face another older person in the house having distressed and agitated. So also the older people, when they are shifted out from their home for the relief camp, they may become disoriented or lost for the days and may go without medications. This is the biggest challenge a caregiver or the administrators or the healthcare providers should know while we go for providing healthcare services. The impact of disaster has been seen by myself when we as a part of the team. This lady requesting us to visit her home, which has been affected by floods, and she is requesting that her husband, who is bedridden, needs immediate attention. So please come and provide the care. So this is what we face when we go to the ground level, where then the people are affected because of floods. The most important impact are anxiety, agitation, depression, abuse, and ageism and immobility of the disaster. So most of these impacts should be minimized, and as a healthcare provider or a caregiver, we should not abuse the older people living with dementia or practice ageism. The older people have the right to be dignified care. So we should avoid ageism in these patients. This is a photograph of a man in uniform from the fire department, wherein he is carrying the old man who is bedridden from the area of disaster to the safe area. Now, what we like to convey you here is that the team works in this situation, like we need the people from NDRF, fire department, we need NGOs, medical health services, paramedical services. So whole team dedication requires in a better management of older people, especially during disasters. We are the part of the services to the people who are affected by flood or the earthquake. Most of the times these services are provided in a school or a makeshift arrangements, and this is a photograph showing myself being visited and attending the older people at various health checkup camps. This is another team from my institute where we reach the areas of flood affected relief camps. Even the difficulties that we face is we have to go by a boat to reach the aid center and provide the services. So our team definitely has undergone all the difficulties and have reached the health services to the needy people even in the most distressed area. What are the various actions and its effects on the older people with dementia? So the different types of disasters affect people living with dementia differently. So the flood or the earthquake or the fire can produce different effects on the older people. Some disasters require people to be evacuated from their home or the residential facilities to the new place, which can be an anxious moment for the older people because a new facility makes them anxious whenever they are shifted for a short-term relief center. And the person most of the time refuses to go out of the home that they have settled for the long years to the new site because they feel that is their comfort zone and they don't want to move. This is another challenge that we face. Now, once we shift the older person with dementia to a relief center or a care center, what we should provide? It is very important to ensure a quiet place free from distractions. In order, the person should remain calm and quiet. There should be a senior friendly facilities in the camp or the relief area. In such camps, we should allow the person with dementia to have access to the regular caregivers that are present in their home. This will keep them calm and quiet, and we should ensure that regular food and potable water is made available adequately for the older people. And the more important thing is continued supply of medications that are meant for dementia and other comorbidities should be provided to the older people in the relief camp. And the most important thing which is practiced in some countries is they put the name badge or a bracelet stating that this person is suffering or living with dementia, so that the person who are providing care or the people in the relief camp can understand that the behavioral changes in him is due to the basic problem that he is having. What the family members should arrange when there is an announcement of an impending disaster? The caregivers should arrange a pair of eyeglasses, hearing aids, regular medications that they are taking. Even if the portable oxygen cylinders that they are having, they can keep it handy, and the list of phone numbers whom they can call, they should put in the pocket of the older person. All the drugs and the food should be packed in a waterproof bag to avoid damage to the contents. And the most important thing, a photocopy of a prescription paper of a doctor provided should be kept in that bag to ensure refilling takes place in a relief camp. The diapers, the wipes and the lotions that are used regularly should also be provided. A pillow or the toys that the older person is fond with, he can be carried with him. The favorite snacks and high nutrient drinks and biscuits. Copies of legal, medical insurance and social security information, if available, should also packed and kept in a plastic bag so that they are not destroyed. And the most important thing, especially during floods, the older people requires the clothes that keep them warm, like a sweater, hand gloves, socks. Those should be provided, and flashlights and the walker or a torch should always be carried, and the walking aids like walker should be also provided along with that. The caregiver can make shirts with embroidered with the contact numbers. This is one example I am showing you the photograph wherein the person living with dementia who had behavioral changes and wandering. So what his daughter-in-law did was she just embroidered the name and the phone number of the contact details on the shirts. She had brought such 6 shirts, and in all the 6 shirts these names were embroidered, and every day the old man used to use a new shirt. So once in a week it used to get washed and come back. So this helped the person in case if they are lost or if they are missed, they can be, their caregivers can be attended easily. So this will help the person, especially who are wandering or they are missed in the relief camp. The role of the family members is equally important in the area where the natural disasters occur frequently. So they should keep listening to the radio or the TV news or the newspaper, so that ensure that there is an preparedness from family members regarding the drugs, the daily requirements, food for the older people with dementia along with the aids that he uses, following a warning of an impending disaster. In certain situations, the older people can be separated from the family members or a caregivers, which is inevitable. In such a situation, they can enroll the name of the person with identification in the services provided at the district administration. They can place the labels in the garments, as I showed you in the previous photograph, to aid in identification in case of person is lost, and keep an article of person's clothing in a plastic bag to help dogs find him or her. This practice is done in Western countries, wherein if the person is lost, the dogs are made to sniff one of the favorite article of the person, and they help to find the older person who is missing. And in case if the family members are working, both the family members are working, they can keep a key of their house with the neighbors, so that in a situation of emergencies, the emergency personnel team can have an access to your home, provide services to a person who is bedridden or is having multiple morbidities. Coming to the role of administration. Why it is important? Because the person with dementia will have agitations, apprehensions and falls. when they are shifted to a new room or a new service area. So, to prevent these disturbances, the older persons with dementia should be nursed in a separate room. A team of consultants like geriatrician, psychiatrist, social workers, physician and a nurse should be involved in providing a comprehensive health care, or they can even shift the older person with dementia to the institute wherein all these services are available in a single floor. In a relief camp, there should be an adequate lighting during night as well, and exposure to the day sunlight should be ensured. Ensure nutritious food at regular intervals, that is very important for them, and measures to prevent elder abuse should be addressed in the relief camp. Common dressing materials like antiseptic lotions, dressing pads and sticking plasters should be provided at the relief centers, because these older people are likely to have minor cuts and injuries. And of course, instruments required for measuring the blood sugar and blood pressure should be available at the relief camps. This is a photograph of a lady who had multiple injuries, as evident of the redness seen on whole of her left forearm and the hand. This is because of the wall collapse that has happened during floods on her hand. These are the people who require team of doctors and paramedical healthcare workers to provide relief to the pain and the injuries. We are also undergoing pandemic situation, that is COVID-19, wherein increased numbers of older people are requiring hospitalization for severe COVID-19 illness. What are the factors that have affected the elderly? They were isolated in the general ward of the hospital. They underwent psychological trauma. They were very frightened. The moment they were told that you are going to be shifted to the COVID ward, they were frightened. And there was a delay in seeking treatment because the older people were thinking that I never went out. Why should I develop corona infection? But they did develop because of their children and grandchildren were moving in and out. The older people had multiple comorbidities which interfere in the prognosis and the care of COVID cases, and of course the personal hygiene was the biggest challenge to be maintained in the hospital wards. So, to overcome these things, what we did in our institute was that we were the part of providing services to the older people having coronavirus infection, that is COVID-19. In this situation of pandemic, what we did to overcome the fear of isolation in the older people and to prevent psychological trauma in them is that we allowed the older people to read the newspaper every day, to listen to the radio, listen to the music, and to some extent we allowed them to meet their caregivers at least thrice a day for short minutes, just a 5 minutes of care, talk, come, meet and go. So, we allowed their children and the caregiver to come and meet them, and we also allowed them to have the food cooked from their home. So, this improved the psychological well-being of this patient. This is a photograph taken by me in the COVID ward, wherein the old man, around 72 years old, he was on NIV mask requiring 100% oxygen with comfortable, and he is reading newspaper because we allowed them, and psychologically he was stable. The older persons with dementia, we had few cases wherein we managed them in the home with help and assistance to the caregivers on day-to-day basis, and the older people with multiple morbidities, especially obesity, Parkinson's disease, had lot of challenges for us, and we tried to overcome by many means. So, pandemic has affected the older people with dementia as well, and we were struggling to provide a better care for them, and in some we have succeeded. So, during a time of disaster, it is an emergency situation wherein it is our responsibility to avoid ageism. The older people should be given priority as well. That too, older people living with dementia should never be ignored. They too have a right for the care. What has been studied is an institute will be a better place for the older people, especially with dementia, during disasters, because the facilities to meet the basic needs and the consultants are all under one roof, easily available. Acute medical emergencies in the people during disaster needs to be attended on priority, especially the injuries, head injuries and multiple injuries over the legs, and especially fractures, what we commonly see during disasters. And for all these things, we need to work together. Who are we? We are the family members, the caregivers, the health personnel, district administration, rescue team people, and all the workers that provide at the relief camps. We need to work together to provide a better service and a better outcome, especially for the people living with dementia. Thank you very much.